Hi, this is Michelle. I'm doing my initial post on the pain management of the teenage mom. First of all, when I would go into the room with the patient, I want to make sure that we're doing very specific teaching to this mom, and I would start as soon as I met her, whether it was, first day postpartum or it was day 3 getting ready to go home. Because when you're dealing with a new mom, but then even especially a new teenage mom, you need to kind of break up the teaching. You don't want to bombard them with a lot of information. Being a new mom is stressful. Your lack of sleep, you got trying to figure out how to take care of this little person that you've never had to do before, and then to be, I'm not sure how old she was, but a teenager. They can't even half the time take care of themselves, more or less. Now we need to them to know how to take care of a newborn. So I would just figure out whether or not, make sure, do only the teaching for whether it was a vaginal birth or a cesarean. And I would explain to mom, for if it was a vaginal, you need to make sure you're taking care of yourself, as in, like, when you go home, if depending upon where home is, if there's steps, you need to try to get as much of the stuff together as possible on the one floor that you're going to spend your most of your day. Because the last thing you want to try to do is walk up a flight of steps 10 times, because you're going to hurt. You want to not try to stand very much for long periods of time or do a lot of walking. You can do little bits of walking, but you don't want to go on long walks. And for her pain medication, the Tylenol and Motrin is going to be her best bet for sense of her past history of drug use. And I would explain the importance of it. Yes, Tylenol and Motrin you don't think are going to be strong enough, but if you can just take them scheduled, Tylenol and Motrin, like, get onto a routine, whether even if you have to, you're already waking up during the night to feed the baby, take it during the night as well. Don't wait till you start hurting to take it. Try to stay on top of the pain. So, like, rotating it, whether it's something every 3 hours or something every 4 hours, just make sure you have one of those in your system at all times. And, if with a vaginal birth, did she tear it off? Does she have stitches? Like, making sure she knows putting ice down there is going to help tremendously. The ice packs that they give you in the hospital, a little trick is that once you break them open for the ice pack to get cold, put a little bit of cold water on top of it, and it gets it even colder. And so that would make her feel even more comfortable. And you want to use a peri bottle with a little bit of warm water to help wash down there every single time you go to the bathroom. That's going to help tremendously with pain. And if it's a cesarean, you want to make sure she still is keeping up with her Tylenol and Motrin around the clock. You want to make sure she knows what to look for, around the incision site, any redness, any drainage, any difference in pain than what her normal pain is, that she needs to call the doctor. And you explain to her, regardless of what type of birth, you're still going to have the contractions while your uterus is healing, and if she's nursing, that stimulates your uterus to contract to help heal it faster, and it can be painful, especially if this is not her first pregnancy. The more pregnancies you have, the more intense those contractions are afterwards when you're nursing. And then when you're talking about, so now we need to figure out how this mom is planning on feeding her child. Is she going to nurse, or is she going to do bottle feeding? Because the breast can have pain as well after you have your child. You can have pain from if she's actually going to nurse, you can have pain from the baby latching, because you want to make sure the baby has a good latch, because if the baby can't open its mouth very wide, or if it has a short frenulum, then that's going to cause the mom's nipple to start to hurt, crack, or even bleed. And I would get her information not only for one just in the hospital, but also an outside one for a lactation consultant. Like Bonds, of course, they have, it's called a women's place, and when you leave the hospital, the mom could go there if she had any questions, or even some pediatricians' offices have them there as well. And then, explain to her what engorgement is, that it's, the swelling of the breast, especially if you are trying to nurse, if the baby can't empty enough, if your milk comes in faster than what the baby is drinking. And then if she's not going to nurse, she could still have engorgement, and telling her what to do, because the last thing you want to do is tell this mom how to express milk from her breast to relieve the pain when she's not going to nurse, because that's just going to make her keep producing more milk. So like you want to teach the mom, and this also is even if you are nursing, because you don't want your milk to all of a sudden come flying in, and when you have a newborn who drinks maybe an ounce, 2 ounces tops, when she takes a shower, I'm going to instruct her how to don't stand in front of the shower letting the warm water hit your front. You want to let the water hit the backside, and only put your front and your breast under the water as least amount as possible, because that warm water is going to stimulate your body to produce more and more milk. So then your engorgement is going to get worse and worse. And then also, so teach her what mastitis is, and that's an infection. You want to teach her to look for swelling, any redness, any drainage, any extreme pain, which is so different than latch pain. And then teach her how to treat the engorgement mastitis. You want to do ice compresses. You don't want to put anything warm, because that's going to make your body make more milk. And then if she is nursing to help with the engorgement, you can even just manually express milk from your breast, or if she's going to interested in running a pump, you can use the pump for just a few minutes to help get some milk out of your breast to relieve some of the engorgement. And in general, having a newborn is stressful. You're gonna have headaches. How can she treat her headaches? You can still use her Tylenol and Motrin for that as well. And she needs to try to sleep, obviously, when the baby is sleeping. Her hormones are out of whack, so that's going to cause headaches and stress. She needs to make sure she's drinking plenty of water to help with this. And being the fact that this mom has a documented history of drug abuse, I would notify her doctor to make sure that they don't forget when they're prescribing their medications, and especially if the mom keeps persisting for the narcotics. I would just not mention their narcotics and try to get mom focused on doing the Tylenol Motrin as much as possible. And if she had to go home with her narcotics, I would speak with the physician stating that we probably should only give her a very small amount of narcotics, especially if it's a vaginal birth and not a cesarean. In theory, you should not have as much pain for as long. And then also on follow-up from the hospital, before the mom goes home, I would help her make sure she calls the doctor's office, goes ahead and gets her follow-up appointment already set and made, so that's one less thing she has to worry about doing when she gets home with a brand newborn. And lastly, when I was done with all of my teaching, I would then ask the mom and say, okay, now what questions do you have for me? Let's go back over everything that I talked to you about. And then if you have any questions, please feel free to ask me now, ask me later, whenever you think of them. I would always encourage her to ask me any questions she possibly could have. And then if any of the things I'm instructing her about, she could then return, demonstrate to me, I would get her to do those. Like if she was talking about how do I manually express some of the milk out of my breast, I would show her how to do that, then get her to show me that she knows what I'm talking about. And just teaching her how to care for herself using the peri bottle, get her to show me as much things as she can is going to help this mom to be able to retain it all. And doing short, frequent teaching. Don't try to bombard her for 20 minutes talking to her about all of this. Do maybe 5 minutes here, 5 minutes later, or another day. Yes, you got to get all of your teaching done, but with a new mom who's already stressed and is already exhausted from just having a new little person they have to take care of, you need to give her breaks and opportunity to be able to retain all of this information.